we'll move to the panel section of our day, and I'm very happy to welcome the moderator and the panelists to talk about their expertise and experience delivering cannabis as harm reduction to our community and to the people most in need. And I think especially in light of Dr. Blusenthal's comments around patient advocacy, patient choice, I think it's going to be very interesting to hear from these folks and their experiences. We're very fortunate as well that the discussion will be led by a friend and colleague, Dr. Jenna Valeriani, who's done some fantastic research in the downtown east side examining cannabis use and cannabis access. I'll introduce her and then she'll bring the panelists to the stage. Dr. Valeriani holds a PhD and is the executive director of Hope for Health, the first registered charity in Canada to focus on medical cannabis access. And she's also the CEO of The Niche, which is a national nonprofit focused on the development of evidence-based public policy, cannabis research, and community engagement. She's also the strategic advisor for the Canadian Students for Sensible Drug Policy and used to work with us as a postdoctoral fellow at the BC Centre on Substance Use with Dr. Ryan McNeil. So it's my pleasure to welcome her to the stage and her fellow panelists.
Hi, everyone. Thank you so much for inviting me here today, especially to our organizers at the BCCSU, UBC, and Canopy Growth for having us here today. So I'm going to give some opening remarks that will hopefully kind of set the stage for the conversation we're going to have. Part of the reason why we're really here is that the ongoing crisis has highlighted this really urgent need for innovation and new interventions, but also really more support for the interventions that already exist. This, in turn, has really led to an increased interest in the potential of cannabis as harm reduction. And we see this in the exponential growth in the research that's happening around cannabis as harm reduction. Particularly, we've seen a lot of media coverage on the impact of more liberal cannabis policy on opioid use and overdose at the population level. But this is an area that continues to be explored and, in fact, contested in a lot of the available science. Despite that ongoing work, I think part of today's panel is really meant to bring our attention back to the individual, where we're undoubtedly seeing really important experiences and uses being captured by the research that's happening. In fact, individual-level data can tell us that cannabis may hold potential as an adjunct or alternative treatment for substance use, but also for those that are managing really complex comorbid conditions in addition to their substance use. In fact, some of the studies that have come out of the BCCSU recently indicate that cannabis use may actually decrease the frequency of crack use, that it could lower the likelihood of injection initiation, as well as increase retention in treatment for opioid use disorder. So this panel highlights that while the downtown east side is really home to a range of very important innovations that are saving lives, it's also critical to keep at the forefront that these are often driven by peers and community members who are really just trying to respond to these immediate needs that they're seeing around them. As just one example, for almost 3 years, there have been 2 very innovative grassroots cannabis distribution programs that have been dispensing cannabis for free on the downtown east side. So over the last year and a half, I had an opportunity to hang out at these programs, and I completed about 25 in-depth interviews with people who use drugs that were accessing these programs regularly. We were interested in looking at what their perspectives were on cannabis as a harm reduction tool. And on top of that, we wanted to know more about how these community-based distribution programs were really shaping not just access, but feasibility of cannabis as a harm reduction tool for this population. One of the programs we're going to hear more about today is called the Cannabis Substitution Project, and it's run out of the Vancouver area network of drug users. In fact, if you've gone by Vandu on a Thursday or a Sunday, you've probably seen the really long lineup, and it's for the CSP project. The other is called the High Hopes Foundation, and High Hopes is run out of the Overdose Prevention Society. Both of these programs continue to rely on donations of unregulated cannabis to keep them going, and really what they're able to offer people each week depends on what they're able to source. I wanted to tell you guys that, from our sample, over 90% reported using cannabis to reduce the use of other drugs, but just about the same reported using for chronic pain, to help with appetite, to help with sleep, and also for pleasure. We're going to dive more into reported uses on this panel as well. It's important to keep in mind that it's not just in relation to opioid use that we're seeing benefits, that half our sample also reported stimulants as their drug of choice. For some, it was that cannabis helped them alleviate withdrawal symptoms. Others, it was really important to their day-to-day management and stability. Or they reported using cannabis when opioid maintenance doses weren't high enough to prevent withdrawals and cravings, which could suggest the utility of cannabis as a really complementary adjunct therapy. And a lot of people simply told me it took the edge off. But while this exciting research is just starting to unpack what the real-world implications are alongside the legalization of cannabis, really meaningful barriers to accessing legal cannabis remain for people who use drugs. The distribution avenues we're going to hear more about today are really playing in this really important function of bridging access to cannabis for many people. And it's not just about access to cannabis. Generally, cannabis is pretty available, but rather improving access to particular products and types of cannabis that generally are not accessible because of cost or because of unavailability on the legal market. Two things that really stood out to me was that they wanted high-dose CBD products, which are pretty cost-prohibitive, as well as high-dose edibles, which will not be available legally even on the medical market. These programs represented the lowest barrier access, and most of the people I interviewed told me they were using these avenues in conjunction with a local unregulated dispensary in the community. In our sample, no one had ever purchased cannabis legally. Anecdotally, in my year and a half of doing that work on the downtown east side, I actually never met a community member who had bought legal cannabis. I think it's easy to shrug that off because, again, we're in Vancouver and cannabis is so accessible, but this has really important considerations which span from unmet medical needs to potential contraindications with other medications, as well as legal implications, particularly as penalties for possessing and selling illicit cannabis have increased, but also when we consider that cannabis has historically been used as a gateway to harass and police marginalized populations across Canada. So today, while we're examining the potential of cannabis as a harm reduction tool, in tandem, we need to be asking really critical questions about what access and availability looks like for all adults. There are still a lot of barriers that are preventing people from accessing legal cannabis. Many purchase points require one piece of ID, sometimes two. The average cost for mid-range cannabis flower is about $8 per gram, and you generally need some type of access to credit card or banking. If you're accessing through the medical system, it becomes a little bit more complicated. Predominantly purchasing directly from a licensed producer, although that has opened up a bit in the recent year, this often comes with ordering online or by phone. We have to think about shipping costs, again, the need for banking, as well as a fixed address for delivery. On top of this, there's actually sales tax and an additional excise tax, even on medical cannabis, which came into force when Canada legalized cannabis in 2018. As a reminder, here in Canada, medications actually aren't typically subject to sales tax, so never mind an additional excise tax. And cannabis is very seldomly covered by insurers. I also learned that many clinics that are focused on cannabis as a specialty continue to have the policies in place that actually prevent them from authorizing cannabis to individuals who are using other drugs. The Physician Colleges of BC has said that cannabis is not appropriate for folks with active substance use disorders. And I say this not to point fingers, but rather to highlight the tremendous work and advocacy that is going to be needed to make this idea around cannabis as a substitution realized in practice. Finally, one of the most least acknowledged barriers, either through medical or non-medical, is the requirement of some kind of minimum ordering that comes along with accessing through legal channels. This is really counter to how a lot of people told me they accessed cannabis, which often included being able to do a little bit of work that day, like binning, and then being able to take literally $2 to $5 cash to a dispensary and access just that amount. These are really critical considerations that have become lost in a tightly regulated system. If we take the time to really consider what equitable access looks like, particularly in marginalized communities, then we can start asking questions like how programs such as the Cannabis Substitution Project could exist with support from local, provincial, and federal stakeholders. These distribution programs and a small network of unregulated dispensaries, which for the most part have been closed, were and have been filling a gap as the new regulatory framework is arguably still being implemented across Canada, a place where legal cannabis as it stands remains inaccessible, simply too complicated, or too much trouble. So if you take one thing away from what I'm saying, I hope it's that, without giving people reasonable access, the potential benefits of cannabis as a harm reduction tool might never be realized. While more clinical evidence is needed to further support cannabis as a harm reduction tool, I think it's important that we're the ones that change, that we do a better job at listening to people and what people are telling us as researchers and policymakers and healthcare professionals. For me, what I've learned over and over is that people are telling us that it helps them, but that we need to do a better job with attending to issues around compassionate access, and specifically looking at the intersection between poverty and homelessness as perhaps the most important considerations when we think about its utility as a harm reduction tool in this context. So with that, we're going to move over to our panel who have a breadth of experience kind of in this area and with kind of what's been going on the downtown east side as it comes to cannabis. We have Christopher Livingstone, Ashley Kislick, and Neil Magnuson here with us. And I'm going to turn the mic over to them to allow them to introduce themselves and to tell us briefly about their work with cannabis and harm reduction on the downtown east side.
Is this on? Yes. Good morning, everybody. My name is Chris Livingstone, or Oaxcoatza is my Nisga'a name. It means cutting the branch towards the water. I work for the Metro Vancouver Aboriginal Executive Council as a peer navigator, and in the past I was a founding member of the Western Aboriginal Harm Reduction Society. I'm not sure how much you want me to go into my story. Just maybe should we just introduce ourselves?
Yeah, that's great, and we can get into the questions.
Great, thank you.
Hi, everyone. My name is Ashley Kislick. I joined the cannabis industry just over 3 years ago, working for Farm Cannabis, which is located at Columbia and East Hastings on the downtown east side. I initially worked with the company in an operational capacity. We were starting to see over 500 to 800 visits a day, as Jenna said, sometimes multiple, or the same people multiple times, and it required us to kind of scale up our operations. And as legalization approached, I switched to community relations because a lot of change management was required to help transition the community with the changes that they could see, and that work is still very much ongoing.
Thank you.
Hi, my name is Neil Magnuson. Thank you for being here. Thank you for having this. I've loved what I've heard so far in a world where legalization is not what we were asking for at all. I opened Vancouver's second dispensary back in 2004 at Main and Hastings, called the Vancouver School of Drug War History and Organic Cultivation. And we were there for 3.5 years, and we provided high-dose edibles to people. And although we thought the population that we would be dispensing to would be cannabis consumers that would venture into that area, pretty quickly it turned out to be people from that area that were using hard drugs and injecting drugs. And they would come and bring us to tears, thanking us for being there and telling us how cannabis changed their path, and how especially high-dose edibles could get them through a night without any of the cravings for the other substances. That experience led me to start the Cannabis Substitution Project about 3 years ago, based on that experience of these people being helped by high-dose edibles. When the city of Vancouver decided to regulate pretty much out of business most of the dispensaries by taking away their revenue streams, one of those was the sale of edibles. And that my response to that was, well, we need to just give it to people and make it as easy as we can for the people that can't afford it to get it. And that was the resulted in the Cannabis Substitution Project.
Yeah, great. Thank you so much. So I think we'll start, since access is such a critical consideration when we're looking at cannabis as a harm reduction tool in the context of the overdose crisis, maybe we'll start with Ashley. So you worked in the downtown east side, you were working at an unregulated dispensary. What do you think are really the key pieces of that model that were serving the community around you well?
I would say that if the downtown east side doesn't like something, you know it. And it was very important for us to keep a constant ear out for when people weren't happy with the way we were serving them, with the products that we were able to carry. It was very important for us to be community-centric and to, even though we were and are still a for-profit business, to really force community engagement and community relations to the forefront of our business model to make sure that every decision we made was informed by the people we were trying to serve. And then I would say beyond that, which would kind of comprise our day-to-day and how we ran things, was having very clear values for what we were trying to do. Farm opened about 4.5 years ago, and those values haven't really changed in terms of how we see cannabis and our belief in people feeling empowered to access cannabis for whatever reason they choose to, and the easier they can access that, the better. And we kind of operated on that principle.
Yeah, that's great. And Neil and Chris, maybe you could speak to the substitution project specifically, and what do you think it is about the model that you guys have chosen and brought forward that that really works in the downtown east side?
Well, actually, the model we use isn't what I think is ideal for the community. We give out care packs, something like that, about 300 of them twice a week. But it's just a random selection that we put together of the things that we get donated to us. We have care packs that have high-dose THC, we have CBD, we have half and half, and we give people a choice of those as they come to the table. But we're about to move into a storefront model where we will have all of the people that get the care packs registered. They'll be able to choose what they want from a selection of the different things that would get them through about a 4-day period. And then when they come back 4 days later for more, they'll have to fill out a survey to get more that talks about how much they used, what dosage, for what, how it worked, all those types of things. And I think that's a better model than what we've been doing, which is to just, like I say, haphazardly put together care packs and hand them out to people as they come to the table.
Absolutely.
Thanks. I was just thinking about, I wanted to sort of tell you guys a little story. I think it was 2007, there was a NGO forum, a United Nations NGO forum that happened at the Morris J. Wask Center for Dialogue. And they had brought together all kinds of people in the healthcare system as part of Keeping the Door Open Society event. But one of the things that I wanted to mention is there's sort of two aspects to it. That I've heard that opioids, if you're an opioid user, that it may not be so effective to use cannabis, which I think that's totally 100% bunk. As well as on top of that, we know that if you open up access to cannabis, by default, there's going to be less people using opioids or other drugs. I started on the streets of Vancouver. I work with the Western Aboriginal Harm Reduction Society, and all of our members use a giant different amount of substances, cannabis included, as well as opioids and alcohol. And that's what I'm sort of thinking is that because of the access and the prohibition, we were pushed down a road that where the only options that are available are the poisons that are out there in the street right now. So by opening the access, and I wasn't here when Neil started the Cannabis CSB program, but I was there for the herb school, and I remember when they got shut down and they got busted, and all the workers there were kind of split out into the street, and then I remember the danger and the sort of helplessness that all the customers and the people that were using the site that they felt as soon as they got busted. All of a sudden there was, I mean, at one time we had 6 to 8 workers there, and they all started from nothing, and they all made it up to, I think they had like $40,000 worth of product and cash in their hand when they got shut down. So these are people that didn't have jobs or income or education, but they were able to make a really nice living for themselves, and they were able to help the community. So that's sort of where I'm at now. Is thank you for bringing the medicine to the people. I think now is a great time to get some research happening. Everybody's always saying that there's not enough research, and what I'm saying is we don't need the research. We already know that cannabis is the tool, the harm reduction tool that we want. I'm here for that reason, because or I'm alive for that reason. I used cannabis and was able to get off of crack cocaine. So that it's not opioid use, but it's stimulant use, and Safe Supply is trying to address all of those things.
Yeah, and I think the growth of these programs, especially, from the time I started kind of following Neil around in early 2018 to now, really can't be overstated. When I started in 2018, I think it was about 80 people every time. It runs twice a week. When I left, it was as high as 200. And talking to Neil before this panel, he said it's somewhere closer to 300 people every week lining up two times to get access to these products. So, considering your experience with these in kind of distributing cannabis in different ways on the downtown east side, whether it's dispensaries or programs like CSP, what are people telling you? What are they reporting? What is it specifically for folks that might know about cannabis that seems to be helping people?
Well, many of the drivers of addiction are pain and anxiety and depression and those things, and cannabis addresses those things as well. It's like all the underlying drivers of addiction cannabis can address. We're getting such great response from people. It's helping them sleep, it's helping them with their pain, it's helping them with their overall well-being. They say it puts them on a different path. It's a happier way to live, if you will. So many good reports. I'd like to address something that Chris said about the reputation of cannabis helping for opioids not being good. That's the smoked cannabis. You can't smoke too much flower. You can smoke 2 good grams of flower, and that's about where you're going to get. You smoke the 3rd gram of flower, you're not going to get much more out of it. But you can eat too much cannabis. You can eat too much cannabis to the point of being comatose for a few days. It's very uncomfortable. It's not nice at all. But because you can eat too much, you can find a dose that works. And so that's why the high-dose edibles are very important for people, because that's what really works in replacing the harder drugs, if you will, because in the edible form, it lasts for hours. It goes through your liver instead of your blood barrier with the lungs. And it's a different type of an experience, and it really does address most of the things that the opioids are addressing for people.
Right. Yeah. And also just like kind of thinking about, what does success look like in this context? I think, for folks that work in harm reduction, we know that it's not just about, stopping the use of other drugs, but for you, when you are talking to people and you say these programs are working, what is it about, what is success in this case?
Ashley?
That's a complicated question.
On an individual basis, you mean?
On an individual basis,
Well,
yeah.
it varies with each individual, as was
Yeah.
so eloquently pointed out before. It really does vary with each individual what works for them. And at Van Du, we have a saying, "Nothing about us without us." And one of the main problems with what's going on with lack of access and legalization shutting down access is they're putting profits over people. And that's a real shame. It's so corrupt. I mean, this is a plant like any other plant, right? I mean, it's a cash crop. People grow things. But at $8 a gram, that's $3,000. That's over $3,000 a pound. There's no grower of any cash crop out there that's getting more than $10 a pound for anything. And the only reason it's that much money is because of artificially inflated prices by prohibition and a government that wants to maintain higher than prohibition prices on these things to line the pockets of their friends. It's all just corrupt. Even the Medical Association, shame on them for talking about harming the developing brain and that people. Dr. Daly at the hearings in Vancouver about providing access to people on the downtown east side was just horribly corrupt in her statements about how dangerous it was and a vulnerable population that couldn't handle it. And that's completely wrong, and it's all about corruption. It's not about anybody putting people ahead of profits. If that was the case, then none of this would be going on like this.
I think we can, definitely understand and respect the frustrations that you guys must feel trying to work kind of within this system. And, the ideal would be that it would be much more accessible for the populations that we're working with. And Chris, generally, I think across Canada, there's really been varying kind of approaches and ideas and support among different Indigenous communities. And we've seen lots of different approaches that are happening on sovereign lands. What is your feel for the acceptance of cannabis among as harm reduction among the Indigenous populations that you're working with kind of on a day-to-day in the downtown east side?
Well, I think nationwide, I think everybody is for cannabis, Indigenous-wise, and I'm just a little worried that we sort of missed the bus in this case. So I think about treaties and the relationship between First Nations people and the government, and I think about reconciliation. And I think that this could have been a great opportunity for Canada or First Nations governments to be able to expand its market share into the economy, which treaties have not allowed to actually happen. So I see a few companies forming out there for distribution in cannabis, but it would have been nice to have to gain a heavier market share in this case.
Yeah. And with the populations you're working with, are you seeing like general acceptance for cannabis as a harm reduction tool?
Yeah, so I wanted to touch back on what success would look like. I heard that on the last. For me, I think, or as a user, I think success would mean that I would be able to access my medicine. I wouldn't have to spend a fortune to get it. I wouldn't have to invest large tracts of time to be able to get that access. It's strange, like you said, that line is sometimes 200-300 people long, and it's the only line in the downtown east side where people are happy to be in a line up that long. So sometimes there's angry. I've seen fights over peanut butter and jam sandwiches in the downtown east side, and people are generally happy in the cannabis substitution line. The problem is that we need to get rid of the line and get more medicine to people and do that more, the studying, as well as garnering support for the program as well itself. There shouldn't be any reason why Neil has to go out there every day and kind of approach all these different people trying to get donations to run his program. It's been very effective. It can be expanded, and it needs a house. It needs when I talk to people, they're generally, they want to participate in it. I think it would be great if we could couple it with housing. We found that programs are more effective if you have those different supports that are there. So to me, success would be that you would be able to move beyond that addiction and beyond that substance and actually work on improving other areas of your own health.
Mm-hmm, absolutely. And so considering kind of the exponential growth of these programs, as you said, like lineups that are 300 people long, you mentioned that the farm had grown and they were serving like over 500 people per day. What are some of the kind of practical challenges that volunteers and people in the community are facing to keep these kinds of programs going? And I know a farm is no longer operating.
Yeah, I would say the farm's biggest challenge right now is that we are not operating. Enforcement geared up and hit Vancouver Island back in, I think, August. And for the safety of our customers as well as our staff, we were forced to shut down. We laid off our entire team, which cultivating a team that thrives in the downtown east side, hiring people for their lived experiences and making sure they feel supported to serve that environment was no easy feat. So letting all those people go was a very big challenge for us to go through. I myself am unemployed as of 2 weeks, if anybody's hiring. So it's a really challenging time because we're just not there. And it was heartbreaking to tell our community that we wouldn't be there because the risk was so high. And I absolutely applaud the people that are putting their lives on the line once again in the cannabis space to take the potential threat of enforcement and just kind of keep doing the work that they can do. I truly hope that there's enough pushback against the community safety unit that's doing these raids to have the government act and have them pause doing any of the raids that they're doing on specific like harm reduction facilities. Mm-hmm. But in the meantime, farm right now is no longer an outlet to people. And our version of success was kind of just always being there. we didn't offer structured harm reduction programming of any kind, but we really valued being a resource for people's recovery capital by just being there. And now that we're not, it makes lines like at the CSP much longer, and they have few other options to go to. And something that Farm always really prided ourselves on is we weren't competing with grassroots initiatives or with other dispensaries in the area. The more choice, the better, as long as people feel comfortable accessing their medicine however they can. So I hope to see an increase in choices for people.
Absolutely.
And for us, it's the donators. The people that donate to us have been really squeezed by so-called legalization. Legalization has been a real cruel joke on the casual cannabis user. The prices are increased from where prohibition was. The cannabis is less good quality, the over-packaging and all the rest of it. But it is an absolute nightmare for medical users or people that are wanting to replace opiate use and street drug use. The access is just not there. And so my gummy maker, the one person who started us off with gummies and is still there 2.5 years later, he's anonymous. He doesn't want to be promoted because he's afraid of being arrested and having his family impacted by that. Other donators that we're donating can't now because they don't have an income to support that, because there's no medical dispensaries to take their products anymore. The two dispensaries that were giving us cannabis flower that we turn into, we roll some up into joints, but we also turn it into edibles. They've both been recently raided by this very improperly named community safety unit. The most deplorable and despicable police force I've ever encountered in my life, going around shutting down access for medical patients to a healing herb, only to protect the financial interests of the non-medical government stores. Is just absolutely despicable that this is going on. It needs to stop. I'm sure we're going to stop it in the courts, but that's a process. And for right now, they've got these places shut down, and people are literally screaming for where are they going to get access. I get asked every time I'm at Vandu, where can I buy this stuff? And it's getting harder and harder to tell them where they can get it.
Yeah, and we've heard a lot of discussion. I guess a good kind of kicking off point is talking about, can programs like the CSP move maybe, I've heard conversations about moving them more into a legal social enterprise model. And at the same time, I think this policy conversation exists in a climate where we never really ever talked about nonprofit retail models across Canada. That never really was on our radar. So I wanted to talk about the benefits and challenges of doing something like that. But first, I thought it was appropriate to ask, is that something that you and the folks who are accessing these programs want or are open to, this idea of more formalization?
We should be legal in what we're doing. We should be supported by government. In fact, they should probably take over what we're doing. But they need to license what we're doing. We should not have to conform to a legalized system that's going to prevent people from getting proper access because of barriers of taxation and all those sorts of things. What we've demonstrated for almost 3 years is that cannabis is not only really effective in what we're trying to help people with, but it's really safe. I mean, this care package here has, this one pack has 3 100 milligram doses in just that one pack. And then there's other packs in here as well. The Bannock that we're providing on a weekly basis probably has about 40 milligrams. This really wholesome cookie that is made and we've been giving out for the full time of the CSP is about 30 milligrams. We give people 400, 500, 600 milligrams per pack. Almost everybody in our lineup, all of our clients will tell you that they've eaten too much on one occasion, and most of them haven't done it more than once. They realize what eating too much does, and it's not nice at all, and they don't eat too much after that. They start low and go slow.
And I think also highlighting kind of the quantity for folks who might not know when edibles are going to be introduced. They're probably going to be on the market in late December. They're capped at about 10 milligrams per package. So that can be really difficult, I think, for medical users who are using, to kind of help them for longer durations of time.
10 milligrams is the right dose for people that have not eaten cannabis before. That's where they should start. But for people that are regularly using cannabis edibles, 10 milligrams is a joke. It doesn't do anything for them. And it's the daily users that are being impacted by this so-called legalization. Daily users can't afford, you said $8 a gram. Well, it's a lot more than that in most of the government stores. I don't know what $8 a gram gets you, but $12 a gram doesn't get you very much at all. A joint is $8.50 for one pre-rolled joint. That's $17 a gram. That's about $8,000 a pound. So it's just outrageous pricing for no good reason. It doesn't cost much more to produce cannabis than it does to produce heirloom tomatoes or most other things that you would grow. All the costs are just surrounded around this the continuing reefer madness about how cannabis is so dangerous that we have to have level 5 security for people that are growing it and things like that. So what we've been demonstrating with the CSP is that it's safe to give out cannabis, even in high doses, even not properly tested cannabis flower, which we get lots of as well. I mean, we kind of do some in-house testing, and I check everything, but what we're going to be moving towards, as I mentioned, we're going to go to a storefront model where people get a choice of what they get. We're also going to have in-house testing. The Green Cross is part of the process that I'm involved with, and they've got good testing equipment, and it doesn't take too much to test the cannabis that you're using. And we're going to have a commercial kitchen and do all food-safe things, and if we're using food-safe practices, if we're in-house testing the cannabis that comes in, then I don't think there's any more need for any more government oversight or regulation on that for what we're doing. The whole cannabis dispensing industry was all self-regulated for 20 years, and there was no problems. The government is not addressing problems by shutting down dispensaries. They're just trying to protect monopolies and financial interests.
I wanted to touch also on another thing, the price and the access. So I live in the downtown east side, right a couple blocks from Main and Hastings, and I go to the Blue Door to get my cannabis now. And I wanted to mention, I mean, the price there is decent, but I've gone to different dispensaries all across Vancouver, and what I found is high prices and plastic in every one of those stores. And that's what I'm wondering with legalization and the way that they permit these places. Like, I mean, the Blue Doors lineup is huge because they're the cheapest. I almost feel like going to other dispensaries in West Van and hand out leaflets that say, hey, the weed is half price over at the Blue Door. Why don't you go there? and then, I mean, it would maybe possibly force people to compete, which isn't really happening right now. It seems to be more of a money grab. And that's, so on top of these licensing more places, why doesn't the city, or could the city create donation boxes or a process within that permitting process where there's a contribution agreement between the CSP and the distribution sites? I'm just thinking we're all sort of safe supply is hopefully coming soon. The PHAC, or Public Health Agency, put out the call for safe supply programs. Unfortunately, we weren't able to respond to it, even though we are providing a safe supply program. But it would be great if it was supported.
Absolutely.
I think it may be important to mention that the City of Vancouver, as a result of our project and the High Hopes Foundation, passed a motion about 3 months ago to license and allow the dispensing of cannabis, low barrier access to cannabis specifically for the opioid crisis, which means high dose edibles. And so with low barrier access, that means good quality medical grade cannabis at good prices that people can afford, maybe a sliding scale for people. And we're going to respond to that motion with such a distribution model. But and this is in parallel to what happened in the late 90s when fentanyl was called China White, and it was killing a lot of people, and that's what resulted in the supervised injection site. And at that time, the answer to the fentanyl crisis or the overdose crisis was a supervised injection facility. We have those in place now. This time around, one of the answers is in a bunch of different answers to this is to have really easy access to medical grade cannabis and high dose edibles. And thanks to the City of Vancouver for at least saying that they're going to license that, and we're hoping that they're going to do that in the model that we present to them shortly when we get our storefront.
Yeah, absolutely. And I guess for folks who didn't know, dispensaries in the downtown east side, even when they were giving business licensing to unregulated dispensaries, the downtown east side was a red zone, meaning that those licenses were not available to them. And really they were trying to kind of bar against providing, that there might be retailers that would take advantage. But at the same time, it is a bit patronizing to not allow access for communities that need it most. And I want to leave a few minutes for questions from the audience. So I think the last question I'd like to pose to each of you was to suggest, one or two ways that we can tangibly kind of move forward. What support do you need or would you like to see happen to move cannabis access forward in the downtown east side?
I'll start off, I guess. I would love to see first and foremost, the CSU halting any raids on any cannabis access point that can substantially say they are providing harm reduction services. And I think that the way in which they do that could be done by the support from the people who access that or whatever. I also think that it's going to take a really long time for the right kind of program and projects to be welcome in any kind of legal way. And in the meantime, there just needs to be a halt on enforcement and an increase in access and support for groups like the CSP and High Hopes. I hope that the City of Vancouver demonstrates leadership in doing that and kind of going to bat against the province and the federal government in order to say, okay, the regulations aren't working for our city here in Vancouver and our people in the downtown east side. So this is what we're going to do until we can all get together and talk about it. And I think it's really important that people that understand what the downtown east side needs, being first and foremost the people of the downtown east side, are forming some type of working group in order to ask for what they need. Like I love Vandu's motto, and nothing about us without us. Yeah, I think that needs to absolutely be the standard for moving forward. I think any research done in this area needs to be done in a manner that reflects being focused on the people that they are studying. Yeah, we kind of just need a big overhaul, a really, really big overhaul. I hope that people like Neil continue to take risks every single day to serve these people, and more people throw their support behind them so that the government has to listen.
Absolutely.
I concur with everything she said, except for it's not just the downtown east side. That this is a problem that covers all demographics, and there needs to be easy access to medical grade cannabis, low barrier access all throughout this city and all throughout Canada. We need to get over the fear of cannabis that's happened because of reefer madness and a government that wants to maintain those kind of prices, and recognize that cannabis is one of the safest therapeutically active compounds found in nature, and regulate it accordingly and make it easy for people to get it. And so, yeah, there needs to be a difference between the government non-medical cannabis and medical cannabis. And those medical cannabis dispensaries, as Judge Phelan said in the Allard decision, are at the heart of access and crucial for medical patients. And they're really suffering right now, right across Canada, with a lack of access due to the so-called legalization.
Yep. Chris?
So I think it would be great if access was opened up nationwide. I'm sort of getting a mental block thinking about things now. I heard that there's a big glut of product now, and I'm just wondering when that product that they've overproduced now will make it down into our...
They're going to turn it into extracts, Chris, and come up with safe vape pens and make a killing off it.
Yeah, so I'm thinking that things like shatter and hash and all these things were sort of invented because they wanted to have larger shelf lives for these things. And I'm just wondering, so when is that medicine going to make it down to us, and will the price actually come down? When I'm just thinking back at the time when Larry Campbell was advocating for cannabis legalization, and his side of it was legalize it and decriminalize it and tax the heck out of it.
Which I also disagree with, because
yeah.
Cannabis is such a benefit to our society. It should be supplemented and subsidized, not taxed.
Yeah, so maybe the tax should come to us or back to the people. So.
Yeah, so thank you all for kind of offering kind of how we can move forward. I think just really keeping at the forefront the unintended consequences of placing people who use drugs at risk when they're losing these current, more affordable access through either unregulated dispensaries or through these programs. While also we know that the penalties for possessing and selling unregulated cannabis have definitely increased under the Cannabis Act. So I want to open up questions to the audience if anybody has any questions to offer our panelists.
Hi, Howard.
Does anybody know about the treatment center in California that is actually using cannabis as a therapeutic option? Like they charge $25,000 a month.
There is a clinic in like Hollywood that is doing something like this, that's using cannabis as one of their pillars in their treatment, but I haven't seen anything like that in Canada. I have seen some research studies, but yeah, nothing as concrete as that.
It's a good thing to look at what they're doing and what their findings are.
Absolutely, absolutely. Any other questions? Yeah.
I'm a little curious about, you're talking about donating. Like, I work for gray market cannabis and I try to work in retail. It comes from like a cannabis pharmacy to selling cosmetics. I know about a lot of donating products and stuff like that. I'm a new edible cannabis company, and it's funny because like I come from gray market and make these products for the product for my best friend's mom, the Bell's called me. And now we have to get legal and we're getting a brand for it and all these different things, but what comes out is corporate social responsibility. So we were trying to figure out how do we get into the ballpark of donating products.
We welcome all donations for sure.
Since it was a gray market thing, now we have to be legal with like a board, raise shareholders, and we have to decide cash to harm or donations. That make sense?
Sure, cash donations I'm sure would be fine, and we're structuring ourselves better for that.
How do we donate our edibles to you?
You can contact me. I'll give you my pamphlet if you want. And I personally look after gathering up all the donations. Like Chris said, every day is a matter of going out and getting more donations and making the project work. We give out over 1,000 high-dose edibles twice a week, so it's kind of hard to maintain all that, but we manage to do that. But I do encourage donations, and I try to make that easy for people that want to donate. I will say that if you're moving from gray market to legal market, that you're putting yourself at risk by donating to us, which is fine. I appreciate people that break bad laws.
How do we push forward all these new companies, like very young new companies, trying to be progressive and kind of sort of force the treatment forward, shareholders and drive profits? That's what it is now. How do we take a chunk of our profits and just flat out give you? I just feel that there's some ways that the Sandrock collective in the island, like how do we do this legal?
I'll come to you and collect them if you want.
I think maybe cash donations.
Yeah, you're fine giving cash for sure. If you start giving us high-dose edibles, then you're at risk with the authorities and, like she said, increased penalties for such things.
And I would say that you're even putting your financial integrity of your company at risk, even with cash donations. If you want to stay truly above board, it is very hard to have a really, really true soul in this industry right now. So I would say that do some stuff on the sly and maybe put some of that money into supporting lobbyists that are trying to make some true changes in regulations right now to make that more of a realistic thing.
And we're going to shift. There's a question online, actually.
Hello. First a comment. I'm getting numerous requests. The webinar cannot hear anything if it's not spoken on a microphone. Okay. So from now on, please use a microphone, or moderator, please repeat the question.
Sounds good.
Now I have, if I could read this. First off, a gentleman in Victoria has said, first he wants to say thank you for all of this, but he has a question to Neil. Do you think it's possible for us to band together to keep the CSU from bothering us? We're not business, but community services.
I think the CSU operates on their own. I don't even think they're discussing the raids that they're doing with the local municipal councils. They may be alerting local law enforcement because it is a law enforcement initiative that they're doing, but they're really just a rogue operation operated through the province. We're going to have the City of Vancouver lobby to have them leave us alone when we open our storefront, and there's some other medical dispensaries hopefully going to be responding to the city's motion, and we're hoping we can get the CSU to back off, but we don't know that, and we won't know until we try. If they do come and try to raid us and shut us down, then I'm hoping that the mainstream media will pay some attention to that, and we can really expose what's going on here with the corrupt system and this protection racket that's being run with our tax dollars for government insiders.
Okay, any other questions? Okay, so if everyone will join me in giving a round of applause for our panelists today.